Hello, everybody, and welcome back from the break. We are now going to switch gears a little bit and have a discussion about immunizations, vaccine skepticism, and public policy. Our speaker is Dr. Dean Blumberg, who is professor and chief of pediatric infectious disease at UC Davis Children's Hospital in Sacramento. Dr. Blumberg is head of infection prevention at the Shriners Hospital for Children, Northern California. He has provided expert testimony at various California legislative hearings and participated in several federal and international advocacy activities. He has worked on clinical trials with the Ebola vaccine development in Liberia on behalf of NIAID. He is co-creator, executive producer, and co-host of the Kids Considered podcast. Dr. Blumberg will talk about vaccine skepticism and public policy. Dr. Blumberg?
Yeah, thank you. So I have nothing to disclose in terms of conflicts of interest. I will talk about off-label use of FDA-approved vaccines because the FDA approves vaccines, but then the recommendations often are off-label. One bias that I will disclose is that this will be based on science and evidence. And so that's my bias towards science. So what we'll talk about is vaccine hesitancy, and there's the recent history because it does go back hundreds of years, and the consequences of vaccine hesitancy, and then some strategies to improve vaccination rates for providers, and anybody who wants to advocate related to vaccines, and then talk about some facts. I think it's important to know the facts, but then also some strategies and opportunities related to vaccination. So some recent history with vaccines. I think a lot of the history with vaccine skepticism relates to vaccinations and autism. And one of the first accusations was against MMR vaccine. And then it was said that thimerosal caused autism. Of course, thimerosal isn't in the MMR vaccine, so that was a little bit confusing. And then it was the spacing of the vaccines, that it was too much too soon. Then it was aluminum in vaccines. So you can see it's sort of a constantly moving goalposts with the accusations against vaccines related to autism. And we'll talk about more about how the vaccines do not cause autism. And then also in more recent years, it's that health freedom has been politicized. And although people have had quote unquote health freedom, people are being told that they need to be more independent and not listen to routine recommendations, and that this makes them somehow more independent. And so this has really increased the non-medical immunization exemptions, and this has really been amplified during COVID. So I'd like to start with sort of the recent history related to COVID. When this is just one study that came out that looked at asking parents, over 9,000 parents in the U.S., an internet panel, and asking them questions about their thoughts about vaccines during the COVID pandemic. And you can see that they were asked this question, if they agreed with this question, that childhood vaccines have many known harmful side effects. And you can see since the beginning of the pandemic, at the beginning, all the way on the left of the slide, this really increased from about 25% over to about 35%. So a real increase in that parents are feeling that the vaccines caused harm. And then this question, do parents agree with this, that childhood vaccines may lead to illness or death? And even a more dramatic rise from less than 20% to over 30%. And so the researchers concluded that parent concern about safety of routine childhood vaccine has increased nationally since the start of the pandemic. And this was seen also worldwide. It's not just a US phenomenon. This is from the World Health Organization, the WHO, that showed that there are worldwide that some children received no vaccinations, that there are millions of children who were receiving no vaccination. Up to 17 million children likely did not receive a single vaccine during the year after the pandemic started, and we've really gone backwards with other vaccinations. Now, some of this was disruptions due to immunization services because of the pandemic. And then even post-pandemic, there's been funding shortfalls, vaccine misinformation, a lot of instability and other factors. This graph shows declining pediatric vaccination coverage in the US, the routine 7 vaccine series at 24 months of age going from 70% to post-pandemic down to 67%. And even this 3% decrease can be significant, which we'll talk about a little later. This map shows the proportion of parents who claim exemptions from kindergarten from the required immunizations for school. The darker states, the blue states that have those have a higher rate of parents opting out of immunizations. And you can see the difference between pre-pandemic on the left to post-pandemic. There's a lot more states that are colored in that blue color, and even the dark green also increases. And so what we're seeing is in a lot of different states, depending on the state laws, that parents can opt out of the required immunizations for school, and that has increased since the pandemic. Now, the way that parents are opting out are for non-medical exemptions. And so that's parental choice. That's parents who are choosing not to vaccinate because of personal beliefs, because of religious beliefs. You can see the medical exemptions are shown in the green line at the bottom. Those are steady. Children aren't getting like more allergic to vaccines or having conditions that are precluding them from being vaccinated. It's just the parents are opting out, and you can see that opt-out rate has increased by more than doubled over recent years. Now, just focusing on California, because that's where I am, you can see that in California has a very low rate of children who miss out on their routine immunizations for school. And part of that is the school requirements, is they don't allow for parents to opt out of routine required immunizations for school unless there's a medical reason. So there is no personal belief exemption in California. But you can see that some parents do continue to opt out for those reasons and remove their kids from school and homeschool their children. And this tends to cluster. So although although statewide the immunization rate is high, you can see in several counties in California, Kern, Santa Cruz, Mariposa, Tuolumne, Calaveras, Nevada, El Dorado, Sutter Glen, Trinity, Humboldt, and Del Norte. Many of these are rural counties, more conservative leaning counties, and those are the ones that are in red where there's a high rate of opting out. And so you can get these clusters of areas where children are vulnerable to these vaccine preventable diseases. Now, because of the nature of this conference, I did want to focus in on the specific populations. And so I did look to see if there's any kind of information on specific populations and immunization rates. And I did come across a couple good studies. So this one looks at vaccination patterns in children after having the autism spectrum disorder diagnosis, and looked at them in the patients as well as their younger siblings. This was 6 integrated healthcare delivery systems across the US, and this was between 1995 and 2010. Children were born between 1995 and 2010, and then their younger siblings were born between 1997 and 2014. And the main outcome was looking at the proportion of children who received all of their vaccines according to routine recommendations. And you can see if you look at this in the red box, it just compares the children who have the diagnosis of ASD versus non-ASD. And you can see that for vaccines recommended between 4 to 6 years of age, children with autism spectrum disorder were significantly less likely to be fully vaccinated compared to children without. That's not surprising, since we know that that there's a lot of misinformation out there saying that vaccines cause autism. So that would make parents more reluctant to vaccinate and follow through with vaccinations for their kids. And then this next table shows for each age category, they're looking at vaccination rates among the younger siblings of children with autism spectrum disorder compared to younger siblings of children without ASD. And again, what you can see is decreased rates. So the parents were spooked and ended up not vaccinating not only the kids with ASD, but also not vaccinating their younger siblings. One other study I'll just call attention to is this one that looks at vaccination coverage by special health care needs. And again, looking at the status in young children. This is a really broad definition, much broader than developmental delay. And this is from the National Survey of Children with Special Health Care Needs. And it's a telephone survey. And so in this study, there's a lot of data on here, and I didn't circle any in red because what happens is overall, there's no significant difference between children's with and without special needs for any of the individual antigens or the combined immunization series. Now, they did find some significant differences by special needs status with certain demographic subgroups, and so those are shown by the plus, where the children with special health care needs have higher vaccination rates, and the negatives, the minus signs, they have lower vaccination rates, and the zero means there's no difference. But there's no consistent pattern among vaccines, among ages, among demographics. So for children with special health care needs, there don't appear to be any particular pattern related to vaccination rates. Now, the reason I show this data is because if children do opt out, if parents opt out of vaccinating their children, there's real consequences. And so we could go through this with several studies, but I'll just show one that's kind of, I think is really straightforward. This is parents who refused pertussis vaccination of their infants, and then it looked to see if there was an increased risk of pertussis of infection in children, if they had more whooping cough. And this was primarily a Kaiser, Colorado study. And what it showed is that parents who refused pertussis vaccination of their infants had a more than 20 times increased risk of pertussis. So that's not too surprising. We know that vaccines work. So if you don't give the vaccine, then there's going to be increased risk of infection. And then this is really shown, I think, more recently with the measles cases that we've seen. So this is US data showing the number of measles cases by year. And you can see in 2025, there were more cases reported in the US of measles than the past 30 years. So, and this is directly related to decreased vaccination rates. This year, there's more than 1,000 cases reported so far. And so this year will probably exceed last year. Now, last year's outbreak started mostly in Texas and Western Texas, Eastern New Mexico. And so each of these dots on this graph show the MMR, the measles, mumps, rubella vaccination rates among kindergartners in each state in the US by year. And you can see there's a 95% threshold in the dotted line. You can see the US median rate has dipped, shown as part of the violet or purple line. And then Texas is highlighted since that's where this outbreak had started last year. And you can see that that has dropped to below this 95% threshold. So measles is one of the most infectious vaccine preventable diseases known to humans. And if we get below 95% population immunity, that's when localized transmission and outbreaks can occur. So that's why that's so critical. So for healthcare providers, it's important to have clear messaging in terms of communication strategies related to vaccines. There's multiple studies that show this. So one is the presumption of vaccine acceptance. This is the norm. The norm is that kids who come in for their routine visits, that parents should expect their kids to be immunized. There's enough room for mild and moderate hesitancy. Parents are encouraged to ask questions and concerns, and then the provider can respond to those. And then also bundling of vaccines is important. So not just nitpicking one or two vaccines out there, but saying, here's the group of vaccines that your child should get today. And then personal anecdotes, if parents are reluctant, saying most of my patients are fully vaccinated. And then it's also useful to bring up current issues. So, for example, last year there were 3 deaths from measles in the US, so that these are serious diseases. So, an example of this is so some kid comes into the room, maybe they're a preteen, saying now that Sophie is 11, she's due for 3 vaccines. These will help protect her from meningitis, HPV cancers, and pertussis. We'll give her these shots today at the end of the visit. And so there's this presumption, but we're leaving room for questions. And then clear and consistent messaging, we've learned time and again, is so important. So it's not just talking with the healthcare provider, the doctor, the nurse practitioner, the physician assistant, but it's from the front office staff and all the way back. Everybody needs to be on the same page. The American Academy of Pediatrics has a lot of information out there, and I'm just put this out for people's reference. They put together this publication, Strategies for Improving Vaccine Communication and Uptake. They've got a flow chart, which I won't go through, talking about how providers can improve communication with parents. And then for parents who end up not after going through this flow chart, if they don't want to talk about it, there's additional strategies to talk about, and then talking about some other issues, including motivational interviewing. So these are the kind of tools that I think providers need. But I think in today's landscape, we do worry about the influence of the news and other issues related to vaccination, considering the current appointees federally that are in charge of our healthcare system in the US. So, because of this, there's been a lot of vaccines in the news, and here's a recent poll that asked parents what they think about the head of HHS, RFK Jr., talked about pediatricians, and also talked about other people who might influence them. And the good news is that although there's a lot of news and a lot of shouting and just a lot of static and chaos related to vaccines over the past year plus, if you ask parents, both Republicans and Democrats, who they trust most about vaccine information, it's their child's pediatrician. Far and away, that's who they trust most. And second most is the local public health department. The CDC has fallen in terms of being trustworthy because the CDC political leadership is not talking about evidence-based recommendations. And then all the way at the bottom, you can see RFK Jr. and health and wellness influencers. So although those people do have really loud voices, fortunately for parents, they trust their pediatricians the most. And so I think that's important for people to know. So when I talk with healthcare providers, including pediatricians, I tell them the first thing you got to know is the facts. And that includes that for every single vaccine that you're recommending for a child, you have to understand like that disease and how it's transmitted. And does it cause kids to be sick? Is it worth preventing? Does it kill kids? And then if there's any age-specific limitations and how kids will respond to that, and understand why it fits in the schedule where it does. And then also to understand all the common concerns that parents might bring to a visit and be prepared to respond to those. So I'll just give you one example. Here's the vaccine schedule from the American Academy of Pediatrics. It looks daunting, but all these vaccines are important for children to receive. You can pick almost any one of these out, and you can make a great case for why children should get them when they should get them, that they shouldn't delay them. So I've just shown one here, the Hib vaccine, the Haemophilus influenza type B vaccine. And then I'll show this graph and say in the pre-pandemic era, this is who got invasive Hib disease. Kids were getting blood poisoning or sepsis with Hib, meningitis, cellulitis around their eyes, pneumonia, and other very serious illnesses that would land them in the hospital, in the ICU, and sometimes resulting in death. They were getting these invasive infections, almost all of them before 2 years of age. So if you're a parent, you don't want to delay this vaccine until later. You want your kid to get it ASAP after they're born, as soon as they can get it and respond well to it, because you don't want to increase the risk of your child getting meningitis from this disease. And then this vaccine has been extraordinarily successful. resulting in more than 99.9% reduction in invasive disease due to this one bacteria. So you could do this with each one of those on this list, almost each one. There are a couple exceptions on here that I think it would be reasonable for parents to delay. But for the most part, almost all of these, kids should be receiving these on schedule, and pediatricians should be able to talk about parents about why that is. So I'm not going to go into great detail about some of the other misconceptions that are out there, except just to mention them. One of the issues that we hear is, why do children receive more vaccines these days? Yeah, they do receive more vaccines, and that's because we're preventing more disease and cancers and other things, and that means they're healthier. And that's why. And then one of the other issues you'll hear is that do kids really receive 72 doses of vaccine? That one's out there. That's really common. And that 72 doses, that would be kids who get every yearly flu vaccine, every yearly COVID shot from birth through 18, and sometimes it counts combination vaccines like measles, mumps, rubella, which protects against 3 diseases. They'll count that as 3 separate doses. And then some even include vaccines given to pregnant mothers. Those are intended to protect newborns in the first weeks of life. So this is really misleading. I mean, COVID hasn't been around for 18 years. There's no way that kids could ever get 72 doses of vaccines. So, but you can count them with parents if they're interested. And then the issue with vaccines and autism. I'm not going to talk about this in great detail, but we know that the rise in autism is not linked to vaccines in the US. Vaccines do not cause autism, period. That's where I start with vaccines and autism. We know certain factors that do cause autism. We know that there are certain genetic factors, environmental factors that are associated with autism. And we know that vaccines are not associated with autism. And we know that the rise in autism, much of that is related to the change in the diagnostic criteria. So you can go through the different studies that have been done. You can talk about the issues related that a lot of this occurs in the prenatal period, and that the change in diagnosis. So there's a lot of information out there on that. In terms of interpersonal relationships between the healthcare provider and the parent, it's important for the doctor to be knowledgeable and be educated, but that's not enough to convince parents. It's really important that they're able to communicate well, and that means listening, not just talking, but listening. Every single parent that I've talked with who has concerns about autism, they all have different concerns about autism. I've yet to find like an identical concern. Everybody needs to be listened to and have individual responses to individual concerns. And one thing that I start with is I'm very empathic with parents who have concerns about vaccines and autism or side effects. There is a lot of confusing information out there about vaccines, and I think we all appreciate that. And so it's really easy to understand how parents might be confused about that and swayed by things. So it's good to have these conversations. One of the other things we've learned is it's not just about facts. A lot of this is about stories, and it's about being able to communicate well with stories as well as facts. So I'm going to change attention now to vaccine advocacy, not just from individual providers and parents, but in terms of advocacy, we've talked about provider education. I think it's also important to have public education regarding vaccine skepticism, and then policy advocacy also. So by no design of my own, I ended up getting involved with vaccine media advocacy. Not something I ever set out to do, but a lot of this is responding to media requests. So media requests, they contact you, they contact your organization, they want to do an interview. So this could be print, radio, TV, internet. And so that could be relatively passive, just responding to that. But you can also be proactive. If you feel strongly about something, you can write a letter to the editor. I know not everybody reads the newspaper as much these days, but getting an op-ed out there, it circulates on the internet, and that could be very useful if you have a strong point that you want to make. And then just to look at the landscape that we're dealing with these days, traditionally the Advisory Committee on Immunization Practices has been made up of experts in vaccines, immunology, public health. These are people with advanced degrees, PhDs, they have MDs and others. They're representatives from mainstream medical organizations, pediatricians, family practitioners, internists, obstetricians, infectious disease specialists, et cetera. They're all vetted for conflicts of interest. They review scientific evidence. There's immunization guidelines that are recommended, informed by rigorous research, modeling, and then there's transparency, total transparency with the agendas of these meetings. Everything's publicly available ahead of the meetings. You can look at the data. I steal a lot of slides from ACIP meetings because they show the current data. That's what historically has occurred. However, under current leadership with HHS, these experts have been sidelined and replaced with anti-vaccines ideologues. So the current recommendations that are coming out of ACIP and therefore coming out of CDC are no longer evidence-based. They're political recommendations. And so that's really unfortunate because somebody like myself, I've always referred to the CDC as my go-to organization. And I don't do that anymore, not under the current leadership. So that's been very confusing for parents. Now, fortunately, a lot of the other organizations like American Academy of Pediatrics have stepped up and come through with evidence-based recommendations. But I think it's important to realize that in the current environment, there's government authority figures who are speaking general falsehoods. And I would say that they are speaking power to truth. They are having these falsehoods. They're using their positions of power to basically shout out and cover up truth, cover up evidence, and cover up science. And so, really, science is under attack in general. So, we know we've heard in the news about research under attack, evidence based medicine is under attack, the NIH grants are being rescinded, universities are under attack. And once trusted institutions like the CDC and the FDA, we can't rely on them in the current environment. And public health is chronically underfunded. And so that's just an issue that we're dealing with. But what I would say is that the good news is we are in the golden age of advocacy opportunities. I think anybody who's interested in advocacy, you couldn't be living through a better time. Here's what happens. The media is going to report a government position or action, and we have the opportunity now to look at the facts. The media is going to seek people like me out when the government says something ridiculous about rescinding some vaccines from childhood vaccines, and the media is going to say, well, what's the other side? And they're going to call me or others and say, what are the facts? What is the other side? And that allows people like us who really want to speak to the evidence, to the science, we can speak truth to that power right now. And it's not hard. It's actually much easier than it was before because I would consider, a lot of the people in power now as really having crude and unserious reform. And what I mean when I say that is sometimes they do stuff just to be provocative. And so it's really easy to have simplified messaging to really, counteract what their messaging is. And there is widespread opposition and outrage to what's going on at the federal level. And that means that there's more opportunities for collaboration. And I think collaboration is key. It's as working in this area for a while, this is something that really is a team sport. It's hard to do alone. It's much easier to use. It's much easier to do as a team and to share with others. So in terms of policy advocacy, I think sometimes we do have opportunities for legislative advocacy. We can meet with legislators or other policymakers. In California, we can go to the California legislature. We can go to school board meetings. We can do things related to what city and county regulations are. And then we can offer testimony too. We can do expert testimony or just supportive Me Too testimony when bills come up. And again, locally, that could be Board of Supervisors, City Council, or school boards. And then nationally, we can also advocate to our legislative leaders, those who are in government. And there are also opportunities for international advocacy too, with WHO, with Gavi, some other organizations also. Now, when talking about advocacy, I'm going to give you all you need to know about advocacy in a couple slides. And so this was a study that came out a couple years ago looking at the benefits of routine child immunization in the US over a 20-year period. These are the tables that were produced looking at number of illnesses, hospitalizations, and the cost of these, and really the benefits of vaccination. And I'll just distill this to you, which is that with vaccine messaging, routine childhood vaccination in the US per year prevents 17 million illnesses, more than a million hospitalizations, more than 35,000 deaths, net savings of $18 billion in direct costs and $90 billion in societal costs. So that's huge. That being said, if you're going to talk with parents or patients, they only care about one person. They don't care about 17 million illnesses being prevented. They care about their child. So I just want to emphasize that saving millions of lives, that's an advocacy argument, but that's not a clinical argument. So that's not something that I bring into the exam room. The other thing to mention is that, vaccines do not cause autism. So those are my main messages when I'm doing policy work and talking about advocacy. But again, that's for advocacy work, and I never bring this up when I talk with parents. So I don't think this is for clinical work. We're not a communist country. We're not telling parents to vaccinate their kid for the greater good kind of a thing. So I just don't think that works. One other thing that you can do when talking about advocacy messaging is talk about measles, because that's just been in the news so much. And so more cases have been reported in 2025 in the US than all of 2024 and really over the past 30 years. And we know in the US, measles vaccine prevents more than 3 million cases a year, more than 48,000 hospitalizations, and more than 400 deaths. And the vaccine does not cause autism. And contrary to what some federal leaders say, vitamin A does not prevent measles. And the costs to local public health, it's more than $30,000 a case. This is really important because local public health is underfunded. And in a county, if you get a measles outbreak, all it takes is a few cases, and that can really blow up the budget. And people care about that. Political leaders care about that on both sides of the aisle. One recent study that just came out last week showed that public health costs a measles case is $75,000 a case. So I just put a minimum here. So that can be very useful for advocacy purposes also. And then finally, I just want to bring up one other issue related to for facts related to advocacy. This just came up last year. The WHO looked at worldwide measles epidemiology and how the vaccine works, and came up with this graph. Between 2000 and 2024, more than 58 million deaths globally were averted by measles vaccine. So the top shows the estimated number of measles deaths without vaccination. The bottom line shows the estimated numbers of measles deaths with vaccination, and the difference between the two is more than 50 million deaths globally were prevented. So that's how well vaccines work. That's how important this is, and that's why I think it's worth advocating for. So I just want to summarize what I think are some of the main points related to vaccine skepticism and how that relates to public policy. And this is a really challenging area. Vaccine hesitancy is really challenging. There's been increased concerns, especially with families with autism, but others also. I think in terms of clinical communication strategies, it's important for providers to have a presumption of vaccine acceptance, to bundle vaccines, to address specific concerns, and then to do motivational interviewing and be aware of all the facts. And then for advocacy, people can do their advocacy for vaccines in the policy area, in the media area, there are plenty of opportunities for that. And I think, again, this is a time where many people are going to have a lot of opportunities for advocating related to vaccines if you're interested in that. So I'm going to end here and
So there's
see if there's any questions or comments that people have.
So, Dr. Blumberg, thank you so much for all the information. And so, I'm going to paraphrase some questions that are sort of similar. One has to do with what are the trustworthy organizations, either within the U.S. or outside the U.S., that we can rely on for evidence-based recommendations?
Yeah, so these days I'm looking at the professional societies. So for my organization, I'm a pediatrician. I look at the American Academy of Pediatrics, and they align really well, for example, with the American Academy of Family Practice, with American College of Physicians, with Infectious Disease Society of America. All those professional societies, those are all agreeing on together on the baseline recommendations that are evidence-based immunization recommendations. And then internationally, the WHO continues to be very reliable, as well as Gavi, which advocates for vaccines. And Gavi is the Global Alliance for Vaccine something. Sorry, I can't remember the name, but they're a strong partner internationally and do a lot of education in that area as well.
And another related question is, at this point, I don't think there are any changes to the curriculum for healthcare professionals, but perhaps maybe some inclusion of what to do for vaccine hesitancy, but not the schedule itself. Would that be accurate?
Yeah, I think that there has been increased education in the medical area for trainees in terms of vaccine hesitancy. So I've seen that myself at the medical school that I'm at, where the medical students do have some role playing, for example, that they do as part of their second and third year training, so that they do get experience in this area.
Okay. So then a specific question for children with special needs and rare diseases. Parents will sometimes say, but the vaccines were not tested on kids with my child's condition, and then quote some sites that their child's brain is more susceptible to vaccine injury. And so if something like that happens, how do we respond?
Yeah, I think those are really interesting questions. And so for every underlying condition, I think it's important to try to understand that. So kids who have some of these rare diseases, it's important to think about what disease do they have? What's their immune system like? Is their immune system weakened? So maybe they shouldn't be getting live vaccines that might multiply more than you'd want them to, but maybe they should be getting extra vaccines because they're more vulnerable to certain infections. So I think each one of those cases needs to be evaluated individually and talk about any kind of real or theoretical concern that might occur. That being said, if you think about a kid, for example, who might have experienced, hypoxic brain injury early in life or something like that, if you think about what their overall condition is, what are their risk factors for infection? What is their immune system like? There's no theoretical reason to think that their immune system is, for example, weaker than others, but they may be more prone to things like pneumonia because they might be at increased risk of aspiration. So they might need more vaccines rather than fewer. So I think it just depends on the individual patient and the individual child and their individual conditions.
And I think especially for children who are immunocompromised, the people who surround them, the caregivers, the care workers, they also need to be vaccinated. If this is not just about children, is that right?
Yeah, that's a good point. So many parents do advocate for that, just like with newborns, for example. They'll say, anybody who comes in contact with my newborn needs to be fully vaccinated. And so, many of these kids may have compromised lung function. If they get influenza, that could push them over the edge. And so it is great to have decrease their risk of influenza by decreasing their risk of contacting that by having a high vaccination rate among their caregivers and family.
Dr. Blumberg, thank you so much for all the information, the advocacy, and the work that you do. And we we hope there'll be an end or a decrease in the hesitancy in the years to come. But thank you again.
Great. Thank you.